15 years ago, or nearly 15 years ago, I started Danville Pediatric Dentistry, really on a wing and a prayer. I had no idea what I was doing. I relied on some friends to help me figure those things out, and 15 years later, here we are. It has been an incredible journey, one in which I never thought that I would do and give as much to the practice as I have, but through some blood, sweat, and tears and hard work, we're 15 years down the road. Together, we've really focused on three important things. That was taking care of our patients in our community, taking care of our staff and making sure that we provided them a livelihood and ways to take care of themselves and their families, and then taking care of ourselves. And we've worked very hard to make sure that we've done those three things as well as we could. One of the things that I've not liked about private practice is that sometimes you feel like you're an island in and of it yourself. And so fortunately, PepperPointe and Arrow Dental came along, and it has been one of the most rewarding experiences that I've had. It allowed us to grow in ways we never thought we would grow. It allowed us to look at things in different perspectives, and it allowed the dentists, the partners, to do what we do best, which is take care of patients and their families and caregivers. For that, I'm eternally grateful. The team at PepperPointe has, for the first time, given me the opportunity to not work from home. I don't log into my patient management system when I leave at the end of the day. I don't go in over the weekends to take care of things, the administrative tasks that we couldn't get done during the week, because they do those things for you. At the same time, the setup is such that you can still have lots of autonomy in your practice. For instance, Danville Pediatric Dentistry is a practice that's very rooted in what we do in the community. Our accountants have told us many times, I could likely have retired years ago if I just hadn't given away so much of what we do through the practice. And we've still been able to do that joining PepperPointe. I think any private practitioner likely will have some trepidation about joining a large group partnership, because you think of a partnership as something that you're giving up, that you're giving a lot of your autonomy away to a group. And that has just not been the case at all for us. In fact, I think we're able to do what we do better because we're together. Our partnership, I think, works because we truly are stronger together. Together, we have one united voice. It allows all of our partner dentists to focus on their patients, their caregivers and families, and their communities. It just started and was like a domino effect. We joined and things just started to improve. We started to see a difference. We started to save money in our practices. We started to be able to use those funds to reach out into our communities. Sometimes you have to just jump. You have to close your eyes and take a leap of faith. PepperPointe was one of those, but I always knew that there was a group of people, the PepperPointe team, and really then all of my partners that were going to be there to catch me.